Hello, everyone. My name is Dr. Peddada, orthopedic surgeon and bone and joint health advocate. It's my pleasure to welcome you all to Bone Voyage, your journey to better bone and joint health. I'm so excited to launch this podcast and share my knowledge and experience with you all. Thank you for being here and allowing me to help you embark on your journey to better bone and joint health. In this first episode, I wanted to give you some background about myself, talk about my motivation for starting this podcast, and explain what it's about. A little about me first. I'm a California native. I was born and raised in the San Francisco Bay Area, but have been all over the country for different parts of my education and training. I did my undergraduate education in the Midwest from Washington University in St. Louis, where I studied biomedical engineering. I then attended medical school at Johns Hopkins on the East Coast. I then came back to California to do my orthopedic surgery residency training at the University of California, Davis. Finally, I completed my subspecialty training in hip and knee reconstructive surgery from Harvard. Since then, I've been a practicing orthopedic surgeon in the Atlanta metro area. For those of you who don't know, orthopedics is the specialty of medicine that treats problems involving the musculoskeletal system of the arms, legs, and spine. This includes problems with our bones, joints, muscles, tendons, and ligaments. Essentially, the parts of our body that help us move and interact physically with the world. What drew me to orthopedics as a medical student was a fascination for the musculoskeletal system, its anatomy and the way it functions, its connection to engineering principles such as biomechanics and material science, and an appreciation of the impact treatments have on the quality of life of patients. When I was in my orthopedic surgery training, I grew particularly interested in hip and knee reconstructive surgery, which mostly involves hip and knee replacement surgeries performed for patients with arthritis. Arthritis of the hip and knee is one of the most common orthopedic conditions and one of the most debilitating. Over the last several decades, we have developed and perfected hip and knee replacement surgery, which in my mind is one of the most revolutionary surgeries of all time and one that many of us take for granted now. This surgery enables someone who has crippling pain to walk pain-free and return to the activities they enjoy. I went into this subspecialty of orthopedics in large part because I wanted to have such a transformative impact on my patients as well. Fast forward to me now as a practicing orthopedic surgeon. In addition to the treatments I provide my patients, both surgical and non-surgical, I've realized the importance of two principles of maintaining good musculoskeletal health that I feel are not talked about as much. These are prevention and awareness. As an example of the importance of prevention, I treat many elderly patients with hip fractures. Contrary to what most people think, hip fractures in this age group are not entirely accidental. They can, to an extent, be prevented through maintenance of good bone health throughout life, earlier recognition of osteoporosis, initiating medical therapy to strengthen bones, and identifying people who are at high fall risk and incorporating strategies to reduce that risk. As an example of the importance of awareness, I often see patients in my clinic who have been suffering with hip and knee pain for several months or even years, waiting because they think it's a normal part of the aging process, or the increase in pain is so gradual that they don't seek help until it significantly impacts their quality of life. We get x-rays in clinic, and we find they have severe arthritis. I do a hip or knee replacement surgery, and they are back to walking without pain and wonder why they did not see somebody sooner. This is an example of how awareness of common musculoskeletal conditions can enable us to seek medical attention in a timely manner before letting symptoms languish and help us make better informed decisions with our doctors. As an orthopedic surgeon, I almost always see patients after the fact, after they have an injury or after they have lived with pain for too long. I'm usually not in an appropriate setting to educate people about prevention strategies or raise awareness of common musculoskeletal problems. When I'm seeing a patient in the hospital for a hip fracture, my discussion is not centered around all the ways that this injury could have been prevented. The focus is on treating the fracture and getting the patient back on their feet. My motivation for starting this podcast is to disseminate information about musculoskeletal health in a venue outside of the office, emergency room, or hospital, where my focus is otherwise on treating patients and helping them recover. Now, we obviously live in a world that has an abundance of information about medicine and health that's easily accessible. We often turn to sources like WebMD and Google, social media platforms like YouTube, Facebook, TikTok, and Instagram, and now artificial intelligence tools for information. With so many sources of information, it can be hard to determine what information is accurate, who to trust, and what's reliable. My goal is to provide you with objective, unbiased information about musculoskeletal health that's rooted in science and my own personal experience as a doctor. I hope to convey this information in an easy to understand way so you can confidently take charge of your health. Let's go over some logistics now of the podcast to get you oriented. We will discuss various topics related to musculoskeletal health. Each topic will consist of a series of episodes that will, in some form, build on one another, so I recommend you listen to them in sequential order. If there are certain topics you would like to listen to or have feedback for the show, I welcome you to send an email to bonevoyagehealth@gmail.com with any thoughts you have. Finally, I would like to share an important disclaimer about this podcast. The content presented in this podcast is for educational and informational purposes only and does not constitute the practice of medicine or other professional healthcare services. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. No doctor-patient relationship is formed. Use of the information presented is at the user's own risk. Always seek the advice of your physician or another qualified healthcare provider with any questions you may have regarding a medical condition or before you make any changes in your healthcare regimen. Do not disregard or delay seeking professional medical advice because of something you may have heard in this podcast. Any third-party materials or content of any third-party site referenced in this podcast do not necessarily reflect my opinion. I assume no responsibility or liability for the accuracy or completeness of the content contained in third-party materials or on third-party sites referenced in this podcast or the compliance with applicable laws of such materials and/or links referenced therein. Everything I discuss is strictly the opinion of myself and does not reflect the views or position of any entity I represent. With that, I hope you find this podcast informative, interesting, and enjoyable. I wish Bone Voyage to all of you on your journey to better bone and joint health. Thank you for listening.
Thank you for tuning in to this episode of Bone Voyage, your journey to better bone and joint health. Please join us on Wednesdays for new episodes. If there are certain topics you would like to listen to, or if you have feedback for the show, please email us at bonevoyagehealth@gmail.com. If you enjoy listening, please follow and subscribe to our podcast. Thank you for all your support.